Hello, I'm called Namusoke Rose, a midwife from Gulu Regional Referral Hospital. Today I'm going to talk about intranatal care. Intranatal care is care given during childbirth or labor. Childbirth is a normal physiological process, but complications can occur during that time that every pregnant woman is at a risk of unpredictable complications, which can lead to either the death of the baby or even the mother, or morbidity. That the presence of a skilled personnel is a key or strategy to prevent these complications. So, skilled personnel like midwives, medical officers on the ward, obstetricians are a great role during this time, though midwives are always with the mothers. The role of a midwife during intranatal is very important. Midwives are skilled health professionals with knowledge and care, and that can give care and support to women to give normal childbirth. A normal childbirth is when labor starts properly and gradually. Then a midwife checks you, checks the fetal heart, examines you as a mother, finds nothing is there as a complication, and waits for you to deliver properly without calling a name or an obstetrician. A midwife will do this. There is continuity of care with the midwife. What do I mean with this? A continuity of care, though, is supposed to start from antenatal. But from antenatal, it continues up to the labor suite. A midwife will be with you, will talk to you as a mother. She will create rapport so that she reassures you to prevent all anxiety, and you get a positive childbirth. That is continuity of care. And after that, the same midwife can continue after delivery postnatally to take your observations during intranatal, even after intranatal care. A midwife, through their clinical observations, they will inspect. Since I told you at first that they are professionals who are trained to help a mother give normal childbirth, but through their clinical observations, they will inspect anything that is deviating from the normal childbirth, as I said, to abnormal. And after that, they will call the medical officer or an obstetrician, or they will call the specialists in case of any arising need, so that quick action is taken. A midwife will always act in emergency care. In case anything is deviating from normal to abnormal, it is a midwife who is expected to call the specialist. And during that time, as the specialist is arriving, maybe they are in the clinic seeing other mothers, a midwife will always do emergency care so as to bring up the life of the mother or even the baby. A midwife always helps a mother to cope up with anxiety during labor by reassuring her. Most mothers, if they are not reassured, anxiety and stress can cause prolonged labor during this. Midwives will always monitor labor progress. What I mean with this, if a mother is in labor, a midwife will always take your blood pressure, will always take the number of your contractions and how severe they are. A midwife will always do that, take the fetal heart of the baby to see how your baby is breathing. We'll always see how your labor is moving on. Like if she has checked you and the cervix, the cervical opening, the opening is about 4 centimeters, there you've now entered active labor. She will tell you when to check you again. She will tell you maybe it's after 4 hours. But again, before that time, she's the one to tell you that during that time, if you see the water powering, you come before that time. And in between, before that 4 hours that you are supposed to report, she's the one to keep checking the breathing of the baby every after 30 minutes to exclude any complication or any abnormality that can arise within that time. That in case it does so, so it is the midwife who will take action by calling an obstetrician, MO, and it comes as an emergency, and they work as a team. I started with international care, the roles of a midwife. Now I'll talk about the complications that are likely or always occur during the time of childbirth or intranatal period. Through good assessment, observations, these complications may not occur. And some of these complications are, we have bleeding during the period of childbirth. This always, in most cases, comes about with these mothers who come late. Labor starts from home and a mother reaches the hospital after 6 hours. During that time from home, nobody has checked you. Then you come from in the hospital. Sometimes when it is late, though you've come, we have to act. That is all time of intranatal period, which could have started from hospital, but this bleeding always happens with mothers who come from home, or it can also happen from hospital with mothers who always keep quiet with their complaints when they don't want to give straight history to the medics. The mother could have fought with the husband and was kicked. That kicking alone can induce labor, and you don't know whether after kicking, the kicking would have separated the uterus from its attachment. That is number one. We have prolonged labor. Prolonged labor always come in with mothers who don't want to keep emptying their bladders. We always tell you to empty your bladders. There are reasons. A bladder is in front of the uterus and the rectum is behind. So when a bladder is full, it blocks the way for the passenger. The baby won't come out fast. In this, it will prolong the hours that you would give birth. Then, complication number 3, we have fetal distress. Fetal distress also can come about after when the labor is prolonged. We expect also the baby to get tired. The baby will get tired if it has failed to come out in time. I told you, you have to keep passing the urine, but if you don't, that's why we always put a catheter inside, the one with the tube, I should call it a tube, to drain off the urine such that you can produce in time, you give birth in time. So during that time, if it's not done in time, the baby also gets tired and we get fetal distress. That is the complication number 3. Then we have maternal distress. Maternal distress is when a mother is exhausted. A mother cannot do anything during labor, cannot push, is just there. That is why we always say to take sweetened tea. This tea helps you to get energy or to become strong. Remember, our bodies is made up of muscles. The uterus has muscles. It is supposed to push your baby downwards. Yourself, in the process of pushing, you have the muscles, the abdominal muscles, they help you in pushing. So if you don't take this sweetened tea to get energy, to become strong, you will fail, and even you fail to push, and even these muscles won't have enough glucose to help you push the baby. Then complication number 3, we have ruptured uterus. That is a fetal one. It can lead to death very fast. This comes about with the mothers. We have types of mothers. Number 1, under this ruptured uterus, mothers who have previous scars. Your precious mothers, or your mothers who are at risk. Don't always labor from home. If you have a previous scar, your mother whose uterus can rupture at any time. And we have those ones who have previous scars, who want to always labor from home, come in the hospital late. Or those ones who have previous, when they are fresh scars. You've conceived after 1 year when they did a scissor. The next example I can give on this, get a cloth that is elastic, tear it somewhere and sew it with a needle. Then pull that side where you've sewn and see whether it will come properly. It will give away where you put the threads, will give away, will tear. Then also pull this side which is elastic and see how it is. That is how the uterus is. A scar tissue is never elastic. It will always give away. Then you get a ruptured uterus, you lose your life, even the baby will die. So that is also there. 2, under the ruptured uterus, we have mothers who take local herbs, These herbs have oxytocin. That is why you take them. From the hospital, we give oxytocin in small bits and small amounts until we reach a level when the mother's got good contractions. Then we reduce and we give it in bits. But as for you mothers, with their caretakers, you take a huge amount of it with the herbs, and even you can keep adding. This will cause excessive contractions without giving a uterus time to rest. The baby will become also distressed here, will get tired, because during that time a uterus is supposed to contract, releases, then gives time for the baby to breathe through the placental bed. So the contractions will be severe, baby won't get time to breathe, then will become distressed, will get tired. 2, these excessive contractions will thin out your uterus to like a thin cloth. Then the next step is the uterus to give away, it will rupture. So mothers, please avoid all this and reach hospital early for close observations. As I said before, I outlined the intranatal care, the roles of a midwife. I talked of complications that can occur. Now I'm talking about the importance of intranatal care. Intranatal care, as I said before, is childbirth time. But all skilled personnel are always there during this time. So we expect during this continuous clinical assessment and checking of the mother, during this time we help to reduce complications that would arise, or reduce any problems that could arise. So during intranatal care, we always reduce the risks that can lead to maternal, mother or baby death. Then it is a name for safe motherhood. What do I mean by safe motherhood? Safe motherhood is the key. All those are steps taken to ensure the health of a woman throughout pregnancy, throughout labor, throughout puerperium. In other words, it starts during childbearing age. You're a girl child. So during all those preparations, taking girls to school, allowing them to eat, not like those days that girls should not eat these, everything that we do for girl child, taking them for being vaccinated for HPV vaccine, all those preparations we are making, those are all steps that we are creating or helping to get a healthy woman that will be healthy throughout, even when she's pregnant, during birth, and even after birth. That is safe motherhood. So it is a name that still continues right away from the end. Those are all steps that we are taking until the mother has delivered. What we are aiming at right away from the beginning and up to the end is a live mother and a live baby. Intranatal care promotes successful breastfeeding. During intranatal care, a midwife is with you. As I talked before, that if you create a rapport with the mother will tell you some of her social problems, which social problems would have affected the mother psychologically if you don't reassure this mother, you don't counsel her. Even breast milk might fail to come after delivery. So through talking to the mother, creating rapport and reassuring her, even after birth, you help her touch the baby on the breast to breastfeed within 1 hour. All of this helps to promote successful breastfeeding. And also it helps a mother to see that she has become a motherhood. It helps a mother to be a mother. It promotes motherhood. Through all that, you counsel a mother, you talk to a mother, you tell her how her baby is after birth, you help her to bond with her baby, attachment to the breast, all that is, it will help to bring up motherhood, to help a mother to be a mother that time, to accept her baby. That is all the importance of intranatal care during childbirth. What is expected from mothers during intranatal? Our mothers, the pregnant mothers, we have our role as midwives, doctors, obstetricians during labor. So we play our part during labor. And you also have a right to know about your labor progress, as well as how everything is going on well, or how everything is going. And we also expect some things or something from you, mothers, as we keep monitoring you during labor. Number one, we need mothers to maintain their hygiene. In most cases, when mothers come, if she's not at the time of pushing, if she has come, we always tell them to go. They first bathe, then we examine them. Some mothers, when they start labor, they don't bathe, they just come, which is not bad. Some fear it could be even their first time of childbirth, experience of childbirth. So we tell you to go and bathe. We just want to prevent, if we are doing your examinations, especially down, we want to prevent introducing any dirt or infection, because if we push in our hands and when the mother's is not clean, though we also clean, it is not good. Then under that also, there are mothers during hospital, when they are laboring or when they are in pain, they tend to sit on the hospital floor, on the floors of the hospital, not to be on the mat, but on the floor. It will give them even beds. It is not good. This hospital floor, it is being cleaned, yes, but it is not a clean one. In most cases, some mothers, the layer that covers the baby has ruptured or has torn off, and it is open. So if you sit on the floor, any infection from there will just ascend, go inside that. After birth, your baby might end up with infection, then it goes to the baby's room, or even you, they might be discharged if it is a normal birth, but after a week, you come back when you have infections. So that is the reason why we tell you to maintain your hygiene. Then you should take sweetened tea fluids, but mostly we want sweetened tea mothers who are in active labor from 4 centimeters up to 10. You need to take sweetened tea. The reason of taking sweetened tea, I talked of it. Tea with sugar gives a mother energy. Glucose is needed because all the muscles, the uterus needs glucose, needs that glucose for the muscles to contract and relax so that the baby is pushed down. Yourself, you need it during the time of pushing so that you have enough energy. I talked of it earlier. You should take sweetened tea. That is the fluids I'm talking of. Then continue emptying your bladder. When we tell you, please, whenever you feel like urinating, you go and pass urine. We are preventing this labor from going beyond normal hours. A person who would spend like 14 hours or 8, those ones who have ever delivered before, you end up spending more hours than unusual because you don't want to empty your bladder. If at all you could. In most cases, if you can't, we put a tube to release and we allow the baby to pass or to go down properly. So you continue emptying your bladder, the urine, the store for urine, such that it does not become much and it blocks the passage for the passenger, that is the baby. Mothers should avoid using herbs, native herbs during labor. They are dangerous. You don't know the toxic content in those local herbs. The oxytocin given in the hospital is given in bits and in drops until when we achieve what we want. But you will take in cups, 1, 2 cups, you don't know the amount which is there. You will make your uterus to contract excessively without resting. In so doing, the baby will get tired, even the uterus will rupture. Then we always need you to ambulate. Exercises. The posture, your posture helps in propelling or in descent of the baby, bring the baby downwards. So if we tell you to walk, depending on which centimeters, if we tell you to get up and walk or sit, then you walk, we are helping you. The posture will help the baby to engage, to come downwards, not to remain up. That is the reason why we tell you to keep moving during labor. Then another last bit, mothers always prepare. During pregnancy, prepare for this time of delivery. Yes, we have our public facilities. Everything is there. Things are free of charge. But at some times, these things get out of stock because everybody wishes to use a public facility, just like me or any relative of mine, everybody. So they tend to get out of stock, and when they are ordered for, they take time, though not big time, it might be like a week to reach. So when you reach hospital and we tell you, we need a cavera, we need, if doctor has written some drugs, we need this drug to be bought. Please, we need a catheter, which is not always that we need. It might be 4 days until when our supplies are coming in. That's why I'm saying, please always prepare. If we tell you like that, you send your relative to go out and bring. So let us help each other.